Dr. Chhabra, you are president of NBI and have been associated with private institutions imparting PG teaching to doctors. What are the major challenges which you face in private sector when it comes to integration of research in medical curriculum in private sector?
Thank you. I would want to start by thanking the organizers for giving me the opportunity and especially to share the platform with my mentor and patron in this field, Dr. Alexander Thomas, who has been into the field for a very long time. When it comes to the private healthcare providers, the barriers which they face are different. And I think the most important barrier is the will and motivation to engage in medical research. And in that, I think one of the most important factors again is the lack of awareness. One, that doctors can be good professionals only if they engage in education and research. It should be an ongoing process. Doctors who engage in research keep updated with the latest in knowledge for treatment and can make better practitioners. So this awareness is lacking. The other awareness that is lacking is that you can have, in fact, it is common knowledge abroad that institutions which are research based have a much higher EBITDA than institutions which are only engaging in service delivery. This sadly is lacking in India. Is there any institution like Stanford or the likes which are again based on medical education and research which is there in India? I think there is none. We can't talk about anyone. But there are models which we can emulate. And one of the main barrier there is again the awareness that you need to also focus on transdisciplinary and translational research. Unless you translate the research, the usefulness of that comes is not there. You can't tap the potential, and that needs to be done on a war footing. Again, we are aware that most of the research which is conducted in India doesn't get published or doesn't get translated. So this awareness is the job which needs to be taken up on a priority and is one of the biggest barriers which may be there. The other barrier which may be there is a lack of an enabling environment, right? Unless institutions provide an enabling environment for research, the doctors practicing there will not be able to practice research properly. And for example, one of the most important barriers in healthcare institutions which are private is a lack of a biostatistics department. So very important for research to be carried out. And doctors in the curriculum do not have a lot of emphasis on biostatistics. And this is one of the great barriers which are there. Then the clinical, ethical and regulatory framework also is often lacking in private healthcare institutions, though they are, but how many institutions in India, private institutions, have an institutional ethics committee? There are many which are lacking, and this may be a barrier. Resource limitation, of course, may be there, but if there is a will, this can always be overcome. You can find out ways and means with that. Again, the difficulty to find doctors who would be interested along with service delivery in education and research is something which is lacking, right? The major institutions across the country, they face a challenge how to have teaching programs, inculcate research, and what to talk about the other smaller institutions which are there. Then collaboration, right, with other academic institutions is not very easy for healthcare providers in the private. And of course, sustainability of research programs. We can go on and on. There are a lot of barriers we know because India being such a vast country, and having problems, healthcare problems which are unique to the country, which are not faced in other Western countries. There is a huge potential to improve healthcare delivery through research programs, and we need to tap this potential.